HIV and AIDS is a many-faced issue. While the disease has obvious health implications, it also bears severe social and economic consequences.
The 2005 Human Development Report emphasizes this by linking HIV/AIDS to other topics in the report, but the story doesn't end at the number of infections or even the death toll.
Let's start by looking at how the situation differs between developed and developing regions. Since the influx of HIV in the developed world in the 1980s, an HIV-positive person that lives in the developed country is still able to lead a relatively normal life. Medication is generally accessible, and although it cannot cure the disease, it does slow down the virus. Access to medication and health care enable an individual to work and allowing them to contribute to the economy and human capital of their country. Their children are cared for and can attend school to get an education so that they can contribute in the future. Should an HIV/AIDS positive person become unable to work, there is a social safety net erected in many developed countries that will provide assistance.
Things are very different in parts of the developing world. A person who contracts HIV/AIDS in a less developed country, Bosnia for example, may become unable to work. This leaves them unable to obtain income, and they are forced to rely on what others can provide for them. This puts immense strain on the immediate family, but also the greater economy. It's also a great struggle to provide food and basic health care. This leaves few workers in the agricultural, health, and education sectors. Subsequently, there is less food available and less exports for sale, potentially cripples the education and healthcare services, despite the need for more. These factors trap new generations in a poverty cycle, where many children are left orphaned, malnourished, and uneducated. Governments also have little money to provide for the country to fix the problem because of the weak economy. Thus resulting in little to be done to treat or prevent HIV/AIDS. In sub-Saharan Africa, only 4% of people receive medication to treat HIV/AIDS, and only 8% of mothers receive the treatment to reduce the transmission of HIV/AIDS to the child. Both demonstrate the limited action to stall the effects of HIV/AIDS.
The Millennium Development Goals was a project started by the United Nations in hopes of combating child mortality, extreme poverty, and disease epidemics, such as HIV and AIDS. The UN has cited 8 international goals as part of this project. Fighting the AIDS and HIV epidemic is part of this venture. The Millennium Declaration states that the goal is to combat HIV and AIDS, malaria, and other diseases by halting and reversing the epidemics. The goal for the successful completion is aimed for the year 2015. Progress has been slow, yet steady. Even though the pandemic has claimed 3 million lives and left 5 million infected, the MDG has been working hard to encourage development in treatment. However, the projected statistics show that the MDG target for reducing mortality rates, specifically with children, will be missed by about 4.4 million unavoidable deaths. Many questions have been raised questioning whether the MDGs are an affordable goal.
HIV/AIDS is affecting the HDI of developing countries in a very negative way. The main problem is that the disease prevents people from providing for themselves and for their families. Many people's sources of incomes are based on labor. HIV/AIDS is lowering the life expectancy rates in developing countries, which affects the economy because there are no longer enough capable workers. For example, in Swaziland, maize production falls on an average of more than 50% following an adult death from HIV/AIDS. The rise of HIV/AIDS in developing countries creates a situation where health systems are being faced with an overflow of patients and are being overstretched. About 85% of those who die from HIV/AIDS are between the ages of 20 to 45 years old, and they make up the better part of the workforce.
HIV/AIDS has a significant effect on any country. However, it affects the developing countries the most. Goals have been set. For example, the UN has established the reduction of HIV/AIDS as a Millennium Development Goal, but there is still a long way to go.